Work so hard.
All right, so we did chapter 19 with his healthcare and environmental policy with Macie, Zach, who is the man straddling me as I speak, Jenn and Jess, who no one knows where the hell they are. There's me, there's Jeffery Jones on his phone and out of sight. There's Jacob and Kelly, and okay, get you some book learning, kiddos. Okay, so Americans are pretty unhealthy. We're pretty obese. We have like the highest obesity rate in the world, next to like some of those like small Pacific Island nations with like the really fat people who like can't digest processed foods or something. We also have like a pretty high cancer rate, and heart disease is also a big thing, and these are all expensive. There's also like lung cancer and COPD and emphysema, which is caused by like smoking, because Americans love that. It's great. But yeah, so all in all, like healthcare costs for Americans are going to be high just because everyone is getting sick. Okay, so because everyone gets sick in America, we spend the greatest percentage of our GDP on healthcare compared to any other country in the world. And so there's been like a great increase on the production of medical technology. Healthcare has been pretty standardized, and we're constantly spending more money on development and research. Despite this, though, we still lack in the fields of infant mortality and life expectancy. I think we're at like 79, 70 something ish years. So we're still pretty low compared to more developed nations like Japan, Switzerland, and some of your better European countries. Despite the amount of opportunities that are available, healthcare in America is still pretty inaccessible to the poor. With Obamacare now, like most people are covered and like they're covered decently, but insurance can't cover all the costs of the nation. So if someone who doesn't pay a lot of insurance or like hasn't paid like a lot into programs like Medicare or Medicaid gets like really sick and they have cancer and they can't afford that, that's put onto the society to pay. And since a lot of times businesses don't often provide insurance for their employees, so like part-time jobs or like some of your like lower paying jobs like fast food or even like just like blue collar work just doesn't provide insurance for their costs or their charges. So, in turn, just healthcare costs are passed on to the rest of the society in programs like Medicare and Medicaid.
The ability to get health care correlates to the demographic factors of the person. Age, race, and medical history can often determine the amount and coverage people get. Lower income families and people 65 and older generally will be covered by Medicare or Medicaid, which are heavily subsidized by the government. Health maintenance organizations are a very popular plan people choose. These generally lower costs, but people are sometimes denied access based on their medical problems. Larger companies have a requirement by law to provide an HMO option to their employees, but will also generally provide an option through a company-provided plan. Nearly 60% of people are insured through HMOs, and about 1/4 of healthcare recipients get insured through their employers.
The role of government in healthcare. So, in research, medical research in the United States was financed by the National Institutes of Health. And for national health insurance, the national health insurance was actually a proposal from the government to have insurance programs to finance all of America's medical care programs. And then Medicare is a part of the Social Security system, which was proposed by Franklin D. Roosevelt, and it covers more than 38 million American citizens. Then Medicaid is a government program designed to provide health care for Americans who could not afford it.
Alright, we're going to be talking about policy making in healthcare. Firstly, we should look at some historical statistics. And as far as expenditure goes, America spends about 15% of its GDP on healthcare, as opposed to 8 to 10% in other developed countries. In 2006 alone, we spent $1.9 trillion on healthcare. And as far as Medicaid goes, only 42% of the people below the poverty line are eligible, as it's reserved for the poorest of the poor. And as far as medicine and care goes, this is reflected by the aforementioned statistics, because as technology advances, efficiency and costs lag behind, leading to more expensive healthcare, but less healthcare for other people. Traditionally, in American policymaking, the American government has taken a hands-off approach to healthcare, with the latest development being them adopting Medicare in 1965. Generally, the equality of care and the cost containment are superseded by the technological growth, which means as technology grows and grows, it outpaces the ability for us to equally care for and for us to efficiently care for people. Meaning that technology costs money, while quality and cost effectiveness keeps that money down. However, there is a discrepancy there where technology keeps going, but the equality and cost effectiveness stays down, which keeps people from being able to afford their health care. Usually, this takes place by the representation of interests through lobbying, which is seen through multiple large interest groups, one of which is the elderly, which tend to push for Medicare-esque policies and the implementation of care, which is applicable to them. However, that latter part is applicable to all the other ones on this list. And they tend to go for like Social Security type deals, which allow them to continue to have health insurance past when they are able to pay for it. Whereas blue-collar workers, they tend to push for what would be seen as more equal representation, which is the reform of insurance so that they have affordable healthcare coverage for middle-class individuals. And this allows them to, it's kind of like takes technology and cost effectiveness and equals them out is what they're looking for. And business owners generally don't want that. They want to keep cost effectiveness to the absolute highest amount. And they don't want people to, it's not that they don't want people to have good health insurance, it's that they don't want to pay for it. So generally they look for more lax laws that allow them to save money, and they tend towards self-sufficient policies as they usually have the money to pay for them. And insurance companies, basically, they just don't want to give anybody any money ever.
It has been known recently that issues with the environment have been known to influence policymakers' decisions, along with influencing how individuals get jobs. What I mean by this is that lawmakers often have discussions about pollution and legislation and how it can be impacted throughout the industry. And recently, the Clean Air Act was one of the laws that actually influenced people to stop building in very clean air areas. So that was influenced, I guess you could say, with policymakers' decisions in the environment, which also influenced economic growth.
So some environmental policies that we have in place include the Environmental Protection Agency, which was established in 1970, and it is now the nation's largest federal regulatory agency. And basically, its job is to deal with the whole environment, so land, air, water quality, and it's very important. The National Environmental Policy Act, also called NEPA, was established in 1969. It's considered the centerpiece of federal environmental legislation because it was one of the first ones made, and it created this concept called environmental impact statements, which requires like people who are doing polluting things to release statements about like how they're impacting the environment, talking about like their carbon footprint, all that fun stuff. The Clean Air Act of 1970 basically made the Department of Transportation reduce automobile emissions. So when you see a car that has like a sticker on it about it being like less emissions and stuff, that's because of the Clean Air Act. Woo. They added an amendment in 1990 that created this concept called emissions trading, which is basically you can like buy and trade rights to pollute. So like certain companies can pollute X amount of pollutants. And some more notable environmental policies are the Water Pollution Control Act of 1972, which a bunch of pollution was happening in the Great Lakes. And at this time, only 1/3 of the water in the Great Lakes was drinkable. So they're like, hey guys, we should fix that. It regulates point source pollution, which is basically like if someone is dumping something into a river, or like you can, or as they say in apes, if you can point to the source, that's point source pollution. But it doesn't really regulate runoff from farms or other things that we can't really tell where it's coming from. But it did a really good job. Only like 2/3 of the water is drinkable now instead of 1/3, so that's cool. The wilderness preservation is just part of their policies. It's not a law, but the National Park System was established in 1960. Since then, we've established over 378 parks, 155 forests, and it's really important in maintaining our like land and the wildlife that lives there. The Endangered Species Act of 1973 created a protection program for endangered species, and it also created the U.S. Fish and Wildlife Service, which it's their job to make sure that the endangered species are protected. Basically, what the act says is that the government must actively protect endangered species, which is why the U.S. Fish and Wildlife Service was created to do that.
Hey guys, so energy and global warming are, so to start, energy. Today most of our energy comes from coal, oil, and natural gas. There's a big push to get more renewable sources such as, wind, hydro, all those different things. The most controversial is definitely nuclear power, as it provides a lot of energy relatively cheap in the long run, but at the same time it has a lot of kind of unknown risks that we have to really look into before we use it more. And so there's different sides of that argument depending on how you feel about the safety side of nuclear power. In the same general idea, global warming is a outcome of our increased and high focus on coal, oil, and natural gas as our main source of energy. And it is something that not everybody agrees with, but is pretty strongly proven it's happening, no matter if it's from humans or if it's just a natural thing. And so global warming is something that needs to be taken into account on political decisions, because it weighs heavily into what source of energy we choose to use.
Okay, toxic waste. So in 1980, Congress passed, or they established Okay, so toxic waste. Toxic waste was kind of a really big issue. A lot of large companies were dumping toxic waste into our earth, and it was causing a lot of problems. So in 1980, Congress reacted by increasing pressure and establishing a super fund. And the super fund is basically just money set aside to clean up any toxic chemical spills, and they get the money by putting a tax on all chemicals created. And so this law has virtually stopped all dumping of toxic waste, and large companies have faced multi-million-dollar cleanup bills. And so even if a company was dumping toxic waste before 1980, they were still forced to pay the bill to clean it up. Another issue besides toxic waste is nuclear waste. The radioactive materials can not only harm us currently, but our future as well. This nuclear waste has to be isolated for at least 10,000 years before it biodegrades, and that's a pretty long time. So in the United States, there's 30,000 metric tons of highly radioactive nuclear waste, and for a while it was just kind of like sitting around. No one really knew what to do with it. But in July of 2000 in July of 2002, President Bush signed off that a place called Yucca Flats in Nevada would be where the nuclear waste was held. So it was all shipped off in large trucks, and that's where our nation's nuclear waste now resides.
Okay, so for making policy that revolves around environmental protections, so as I've talked about earlier, there's a really heavy reliance on fossil fuels that contribute to the greenhouse effect that are possibly playing a role in global warming. And so as we move on, we either have to decide to continue with our cheap use of fossil fuels, which allows us to get a lot of energy for a cheap amount of money, but possibly have a negative impact on the environment, or try to find alternative sources of energy that would be very costly for us. But so that plays a big part in policy that has been made by our government, as they have to decide if we will maintain our current status of using that cheap fossil fuel, or invest a large sum of money into trying to find a new source of energy. So basically, to conclude, democracy, healthcare, and environmental policy altogether is a very high technology issue that makes it hard for. So to conclude, democracy, healthcare, and environmental policy all are very high technology issues that are hard for an average citizen to completely understand. but thanks to the government, they have it under control.